Hi, I'm Jim Smyrniotopoulos, and today's MedPix video is on imaging of brain hemorrhage. We have no significant financial disclosures, and the opinions expressed herein are those of the author and should not be construed as being official. Hemorrhage can have a very complex appearance on MR and CT. The appearance on MR is especially going to change based on the pulse sequence and the time after the hemorrhage has occurred. We have an MR scan here showing microhemorrhages from amyloid angiopathy, a blood fluid level from pituitary apoplexy, multiple hemorrhagic METs on a CT scan, hemorrhagic transformation of a brain infarction, and extraaxial blood collections, an epidural hematoma, and a subdural hematoma. Let's think more closely about how blood should appear on imaging. What is blood? Blood is a mixture of fluid and cells, approximately 35 to 45% red cells. That's your hematocrit. If we think about whole blood, the red cells and the fluid are intermixed. But if we allow blood to clot or to settle out by the hematocrit effect or sedimentation or by gravity, we can separate the serum, which has a very low attenuation of 0 to 10 Hounsfield units, from the red cell mass, which is going to have a high attenuation of 60 to 90 Hounsfield units. And of course, the low attenuation of the serum will be dark on the CT scan, and the high attenuation of the red cells will be white on a CT scan. If we think about the normal density of the brain, it falls between about 20 and 40 Hounsfield units. An acute extraaxial subdural hematoma is going to be hyperattenuating in a patient with a normal hematocrit. It will be hyperdense with a Hounsfield value of 60 to 90 units. If the patient is untreated, several weeks later in the chronic time frame, the blood will be digested and break down, it will become liquefied, and we will have a low attenuation or a hypodense collection of about 0 to 10 Hounsfield units. Of course, if blood starts white and ends up being black, it must pass through a phase where it will have nearly the same attenuation or density as the adjacent brain. And this is the subacute appearance of a subdural hematoma, where it is nearly isodense to brain at about 20 to 40 Hounsfield units. Now, the appearance on MR is much more complex. It's like a chemistry experiment, and we have to think about the oxidative state of the iron in the hemoglobin as changing the signal intensity, and we talk about susceptibility and paramagnetic effects of the iron moiety in the hemoglobin. Gorin, too, in the 2011 RSNA, created a wonderful graphic representation of the changing signal intensity of blood. The vertical axis is the signal on T1, the horizontal axis on T2. A hyperacute hemorrhage will have intracellular oxyhemoglobin, which may be bright on the T2 weighted image and isointense on T1. After several hours, we will have the conversion of oxyhemoglobin to deoxyhemoglobin, which is going to be quite dark on T2 and T2 star weighted images. After several days, the deoxyhemoglobin is converted to methemoglobin. Methemoglobin is going to be bright on the T1 weighted image, but remain dark on the T2 weighted images. Wait several days more, and we will have the breakdown of the red cell membrane and the release of methemoglobin into solution. In solution, methemoglobin is bright on both the T1 and the T2 weighted images. Wait several weeks, and macrophages, scavenger cells, will come in to pick up the blood products of ferritin and hemosiderin. And once again, we now have an intracellular blood product. And the intracellular ferritin and hemosiderin are going to be dark on T2 and T2 star images and maybe slightly hypointense to isointense on the T1 weighted image. So we have this very complex two-column multiple row chart showing the pattern of changes of signal intensity over time on T1 and T2 weighted images. Some people have summarized whether the blood product is iso, intense, bright, or dark by looking at this mnemonic of IB, II, ID for iso dark, BD for bright dark, BB for bright bright, and DD for dark dark, the transformation of blood products over time. But even this is hard to remember. So a good mnemonic tool is to remember this. I be itty bitty baby doo-doo. ISO bright, ISO dark, bright dark, bright bright, and dark dark in chronic hemorrhage with hemosiderin and ferritin. This has been Jim Smyrniotopoulos, and I approve this message. Thank you very much for your kind attention.